Good evening, my president, fellow Rotarians present, and visiting Rotarians. I'm here to talk on the topic maternal and child health. We all know that this July is maternal and child health period. So, let's brainstorm on maternal and child health. First of all, by introduction, what is maternal and child health? Otherwise known as MCH. This is the health services provided to mothers. When I mean mothers, I mean women on their childbearing age and children. The targets for maternal and child health are all women in their reproductive age groups, which falls between the ages of 15 to 49 years of age. Children, school-age population, and adolescents. These are the people that make up the maternal and child health care. Then we'll talk about the components of maternal and child health. They include maternal health, that is the care of the woman in course of getting pregnant. Then family planning is also there. We also have child health, school health, handicapped children, care of the children in special settings such as daycare centers. Now we'll talk about what is the meaning of child health. Child health is a state of physical, mental, intellectual, social, and emotional well-being and not merely the absence of disease or infirmity. The person must be sound, not only when the person is sick. Healthy children live in families, environments, and communities that provide them with the opportunity to reach their fullest developmental potential. Why is maternal and child health important in primary health care or in primary health care setting? Maternal and child health is an important public health issue because we have the opportunity to end preventable deaths among all women, children, and adolescents, and to greatly improve their health and well-being, especially in course of getting pregnant and giving birth. No woman or no baby, neonate, is expected to die in course of delivery. No woman is expected to pass on to the great beyond in course of putting to bed. What are the components of maternal health care? Maternal health care is the health of women during pregnancy, childbirth, and the postpartum period. And the maternal health care services, they include antenatal care, delivery care, and postnatal care services. We also talk about what are the factors influencing maternal health. Factors influencing maternal health include age, marital status. When I talk about age, there are certain, when a girl child has not attained that age and she gets pregnant, the developmental structures are not well in place. In course of that, she might die or have what we call VVF, passing stool in the wrong channel. These are factors influencing maternal health. Marital status, residence, women's educational status. Some women, when they fall sick, instead of going to the hospital, they are waiting for their husbands to come and give a go-ahead before they go to the hospital. They know what to do, but my husband husband has not given me permission to go to the hospital to access care or for the baby to access care. Healthcare decision making. Their healthcare decision making, everything is left in the hands of the husband. If my husband is not there, for instance, a woman is pregnant, she has gone to the hospital, doctor has seen her, she cannot put to bed per vaginally, and CS is the next option. She will not accept that CS. She will prefer to go to a traditional birth attendant where she will waste her life and probably that of the baby. It is not supposed to be like that. No woman is supposed to die in course of giving birth, and no child is supposed to die in course of coming into this world. We also talk about autonomy. Autonomy. The woman has no autonomy to take decision about her health. All these things plays a big role. These are factors that influence poor maternal health and child health. Exposure to media, wanted pregnancies, and parity. These are factors that significantly affect the initiation of antenatal care. Family planning, like the state government now has made it that if you attend 4 antenatal visits or more in a health sector, in a primary health sector, your delivery is free. Your delivery is free in the sense that you attended those antenatal clinics, and that should also spoil you. If you see somebody outside and the person is pregnant, please tell the person to go to the hospital. You're delivering free, you are not paying a dime, provided you come with all your baby things. Now when they hear that delivery is free, they just come empty-handed, not even with baby clothes, not even with pampers, not even with their own wear. Government said just come for antenatal visit. By God's grace, as baby is coming out through the normal channel, what you owe the midwives or the nurses there, thank you. Nobody's forcing you to pay anything. So please, on this note, family planning is also included. If any price is attached to family planning, many people cannot afford it. So we plead with our people, our children, our brothers and sisters, our wives. The health centers are open. Come and access your care. Some persons go to the chemist to access care. Their vital signs are not taken. But when you go to the health centers, your vital signs will be taken. If there are any abnormality, you will be referred immediately to the doctor for appropriate treatment. The chemist man is there to sell his drug, whether you like it or not. He bought it with money, and he must sell it. Instead of our children going to do abortion, encourage them to come to the facility to access their family planning services. Some people have the belief that when a girl child does family planning, it sets her up for promiscuity. It doesn't. I keep telling people, a woman that did family planning and a woman that did abortion, who has committed sin before God, is the woman that has aborted, because you don't know how many generations that you have wasted. But when you do family planning, everything about the woman is intact. The egg is intact. Pending when she will see Mr. Right, then she stops the family planning, she go into production. You and me know that these days things are very difficult. Family planning is not only to say the number of children you will born. It also makes the man to be happy. It makes the woman to be happy. Men come to the family planning section to access condoms. Male condoms are there, female condoms are there. All this, the government made it available at a cheaper rate that everybody can embrace, instead of our children going into unsafe abortion, and we begin to hear problem. Do I have any question from anybody?
First of all, let's encourage that. Any question, please, you're free. With all this elaborate lecture, please, someone should ask. At least me, I've had one.
Let me ask one. Why is it that the men find it difficult to use the condom? They'll tell you it's not sweet. Is there a friction? What causes that conception?
Sometimes some people don't know how to use the condom. They will tell you Rough Rider, they will tell you Goat Cycle. They all do the same work, provided you know how to use it. When you go to the shop or you come to the facility to buy your condom, ensure that you examine it. If it is balloting inside, know that it is okay. Because there is also a chemical, something like Vaseline, that is rubbed on it. Now, it is worn on an erected penis. You can't just come like this because you've seen the woman immediately wear the condom. It will not stand. The penis must be erect for the condom to be worn. And when you want to wear it, don't be in a hurry by using your teeth. Because of using your teeth to tear the cellophane, you might inflict injury on the condom. Then you say the condom is torn. And while using the condom, if you have not arrived, that's your first round, it has not completed, you go down to go and drink water. I said, when you come back, remove it and wear another one. Because air, AC is blowing, fan is blowing. It has dried off the lubricant on the condom. So by the time you use it to go back again, the woman has some hairs. We call it bush. Some people don't shave. By the time you try to penetrate, that hair now will put spots on the condom. It's one cut that you, with ordinary eye, you can't see it, but with microscopy, you can see it. That the condom is torn. All the condoms, both Gold Cycle condom, Rough Rider, whatever you call it, they do the same work provided it is properly used. Condom does not only prevent pregnancy, it also prevents infection. That is one thing we should all know. We have hepatitis, we have syphilis, we have gonorrhea, and the rest of them, sexually transmitted infection. There are many. Condoms help to prevent them. Any other question?
Please, madam, you said, oh, sorry. Go ahead. Okay, can I ask my question?
Yes, sir.
You said, you can actually approach the hospital once you've done 4 antenatal visits.
Yes.
Yes. If it is less than that, you can't go. Less than 4 visits.
Government put a standard, 4 antenatal visits or more. Why is it said like that? Because in our African culture, our women believe that they will not go to the hospital. Some of them don't come to the hospital until the day they are ready to give birth. They will just walk down to the hospital. It's not done like that. You have to be checked. Your blood level has to be checked. The protein in your urine has to be checked. Your sugar level has to be checked. Your blood pressure has to be checked. If these things are not checked, you have problem. You may or may not have problem, but you need to go early. They say the moment a woman discovers that she has missed her period, that day her registration has started, so that she will be monitored.
All right, now what about, is it just for government-owned hospitals or private hospitals to also go with this law?
It's only government-owned hospitals.
Thank you. More question? Any other questions?
I'm not sure the pregnant woman change location. Let's say she has attended like 3 prenatals, and then let's say she's in Port Harcourt. Can she also access the general hospital to use the?
We're talking about primary health care sectors. We're not talking about general hospital. When you talk about general hospital, you're not talking about secondary health care. Healthcare system is divided into three. We have the primary, the secondary, and the tertiary. The primary health center is this our health centers. They deal with grassroots. I'm coming, I will answer you. Then the general hospital had to do with secondary health care. When the primary health care cannot manage, we now make a referral to the secondary health care, being the general hospital. Now, when the general hospital cannot manage, they now send to the tertiary institution, like the teaching hospital, River State University Teaching Hospital, that is former BMH. Now, if you travel, you are in a location, you have attended 3 antenatal visits, you travel, it is left for you, the pregnant woman, to inform your caregiver, please, I am traveling, I may not have my baby here. As it is, you will be given a referral note to take to that next facility you are going to. When they see the referral note, they will know, because it is going to be stated there what and what has been done for you, so that they will handle you properly. Are you okay? You're welcome.
Okay, I have a question. I think you stated earlier that the young mothers, younger age mothers, are the ones that usually have these complications from pregnancy or even fatality as a result of childbirth. What then happens when a woman that has had 2, 3, and even 4 children now dies after the 4th or 5th birth?
Now we are going to go into anatomy of the reproductive system as it has to do with the woman. Like in the primary health sector, we have what we call SOP, standard operating procedure, that we operate with. And you must not operate outside the guideline. The government does not want to hear that any client dies in the primary health sector. When we manage you from the primary health sector, we cannot manage you again. The next place we have to refer you to is the general hospital. Now we talk about primary cases that are not being managed by the primary health sector. We talk about primates, multiparous women that has given birth to more than 3, 4 children. We call them multiparous women, because the uterus is a muscular organ. It's like a woman that has one pant. You wear it in the morning, in the evening you wash it. Maybe it may not dry well. In the morning you're going out again, maybe king say, the whole women, come to LND roundabout, they want to give you work. You go and carry that pant again and wear. You come back, you wash it. Oh, they say, every woman come to women hall, you go and carry that same pant again and wear. What is that? What are you doing to that pant? That pant is getting loose, and that is how the uterus gets loose. When the uterus gets loose like that, the muscular organs get loose. When they get loose, they don't have grip again on the baby. Before you know, those such cases are not supposed to be managed in the primary health sector. They are being managed at the secondary health care, because they run a 24-hour service. Trained personnel are there, the doctors, everybody is there. If there's anything, they will know what to do immediately. So nobody is expected to die. Even the women that have not given birth before, because of tightness, if a woman that has not given birth before comes to deliver, it takes a longer time than somebody that has put to bed once. Because there's what we call dilatation of the cervix. As the woman is contracting, the cervix is dilating. And if it is the presenting part is the head, the cephalic, it will be, as she's dilating, it's pressing on the cervix to dilate to an extent where baby can come out. So their time takes longer. But most of them don't know. When they come, they expect you that magic will happen. It's a natural phenomenon. Nature will have to take its course for the pathway to be open for baby to come out.
Please. Jacqueline, you've given us enough tools.
If you want to be a good speaker,
join the Rotary.
If you want to be a good speaker,
join the Rotary.
Oh, join.
Join the Rotary and be a good speaker. If you want to be a good girlfriend,
Join the Rotary.
if you want to be a good girlfriend,
Join the Rotary.
oh, join the Rotary, join the Rotary, join the Rotary and be a good girlfriend. If you want to be a good boyfriend,
Join the Rotary.
if you want to be a good boyfriend,
Join the Rotary.
oh, join the Rotary, join the Rotary, join the Rotary and be a good boyfriend. Thank you very much.
Thank you so much, Jacqueline. Like I said,